High blood pressure or hypertension is a common condition found in 1 in 3 adults worldwide. That's according to the World Health Organization's first ever report on the global impact of that condition. Joining us this morning to talk a little bit more about what this means is Dr. Kumar with Austin Gastroenterology. Thanks so much for joining us this morning, Doctor.
Good to see you, Leslie.
Yeah, good to see you as well. And 1 in 3, that's a high number.
It's a crazy high. You know, a third of people in the world are affected with high blood pressure. Well, it's a result of multiple things, genetics most importantly, so if you have a family history of it, but really a high salt diet, a relatively lack of exercise, lack of sleep, the things that we all go through are also risk factors. So there are ways to mitigate it. But yeah, 1 in 3 people are affected with high blood pressure. Most people don't know it, and that's the problem. And untreated, it can certainly lead to end organ damage.
Yeah, before we get into what to look for, tell us, what else did this report show?
Yeah, so across the world, it showed us that perhaps we could save as many as 76 million lives if we were able to diagnose and treat high blood pressure everywhere across the world a lot more effectively. It would come in with primary care practices, with delivery on the ground, as to identifying people with high blood pressure, because most people don't know it, because many people are asymptomatic.
Right.
And what happens in the world also happens in this country, and those numbers are probably applicable to us as here in the United States as well.
Yeah, that's so interesting to me that most people don't know that they have it. So what are some things to look for? What happens if this goes untreated in people?
Yeah, and so the reason most people don't know it, because it's considered the silent killer, because it can be asymptomatic. Now, certainly when your blood pressure goes up really high, we should say that set the groundwork. 140 over 90 is considered high. Anything, the top number being below 140 is okay. The bottom number being below 90 is okay. But when the top number goes above 140 and the bottom number becomes over 90, the pressure in your vascular system increases, and so there's pressure on the end organs, meaning your heart, your kidneys, your brain, and so you're at risk of heart disease, kidney disease, strokes, heart attacks, all of those kind of things. And so if your blood pressure goes up to 200 or 190, extremely high, you can become symptomatic. You can have headaches, you can have nausea, and you'll think to go to the emergency room or have somebody check it. You go see your doctor, they'll diagnose you with high blood pressure. But most people aren't like that. They're running around 150, 155, at 95. It's above what you want it to be, but it's not so high that you know that it's high, and you usually don't find out until you've had your heart attack or your stroke or you're on dialysis. So that's why it's important to find out ahead of time. Yeah.
What are some things that can be done? You mentioned lifestyle. Should we be checking? I've seen the little machines at the grocery store. You put your arm in there.
That's the way. We were just at the grocery store this last weekend, and they were having free blood pressure checks, and I went ahead and got mine checked. Yeah. And I get mine checked. You imagine, in the health industry, frequently. But I checked it, and it was okay. But we should make avail of these easy-to-use instruments readily available at your pharmacy, your grocery store, at your fire station. You can go and just check them periodically to make sure that you're not creeping up above that number. And if you are, to start modifying your lifestyle and checking in with your primary care physician to make sure that reading's accurate.
Yeah, we're coming up on time here, doctor, but I want to make sure. So reducing your sodium intake.
Yes.
Get moving.
Get moving. Healthy exercise. The fundamentals that we should all be doing all the time. A healthy diet, getting adequate amounts of sleep, adequate amounts of exercise, and not being so sedentary. These things go a long way to keeping us healthy.
All right, so if anybody needed a little bit of a push to get moving, there it is. All right, Dr. Kumar, we appreciate your time as always. If you have any questions, you can email us at askdrkumar@gmail.com. You can also check out his website, drkumar.com. Thanks for joining us. We'll be right back.